Good afternoon, members, and welcome to the Assurance Audit Risk meeting for this month. Denise, could you call the summons, please, and take the roll, please?
Yep, no problem, Chair.
Thank you.
Good afternoon, members. You're hereby summoned to attend the bi-monthly meeting of the Assurance Audit and Risk Committee held remotely today, the 19th of April at 4 p.m. Take the roll. Councillor Sean Carr.
Here, Denise, sorry.
Thanks, Sean. Councillor Gary Donnelly.
We're having a wee bit of power getting on, but it'll be on shortly.
No problem, thanks. Councillor Emmett Doyle.
Here, Denise, thanks.
Councillor Mary Durkin.
Oh, Denise.
Thanks, Mary. Alderman Darren Guy.
Here, Denise.
Thanks, Darren. Councillor Dan Kelly.
Oh, Denise.
Thanks, Dan. Alderman Keith Kerrigan.
Here, Denise.
Thanks, Keith. Councillor Patricia Logue.
And Shaw.
Thanks, Patricia. Councillor Kieran Maguire.
Sure, Denise.
Thanks, Kieran. Councillor Jim McKeever. Councillor McKeever.
Here, Denise.
Thanks, Councillor McKeever. Councillor Philip McKinney.
Here, Denise.
Thanks, Chair. Councillor Maeve O'Neill.
Here, Denise.
Thanks, Maeve. Alderman David Ramsey. I think we have apologies from Councillor Ramsey.
We have apologies from Councillor Ramsey, Denise. Sorry, Alderman Ramsey.
Alderman, sorry, thank you. Councillor Martin Riley.
Here, Denise.
Thanks, Martin. Thank you, Chair.
Right, I'm now going to read out the statement for remote meetings. I would like to remind everyone who is in remote attendance that this meeting will be broadcast via live the Council's YouTube channel and will be available for viewing by the public and media. The broadcast will also be available for repeated viewing at a later date. This broadcast may be terminated or suspended in accordance with the Council protocol. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. By participating in this meeting, you're consenting to be filmed and to the use and storage of these images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. A copy of the Council privacy notice may be found on the Council website, www.derrystrabane.com. Have we any declarations, members? I take that as a no. If anybody does decide they need to make a declaration, please do so during the meeting. Right, and I want to move on now to Chair's business. Councillor Doyle wishes to raise an issue, but before we start, I'd just like to say that I won't be accepting any motions on Chair's business, and that if you wish to propose a motion, you do it full council or ask full council to bring a paper be brought to the relevant committee. Okay, Councillor Doyle, you now have the floor. Thank you.
Thank you, Chair, and for your indulgence. I want to raise with members today what I see as a very serious and potentially wide-ranging problem. I want to firstly declare an interest both as a member of the Ballyarannet Local Growth Partnership and of Cairnhull Resource Centres Board. Members of the advice panel will be aware that in recent months we have received reports as to the proposed way forward for funding, the outturns for the last 9 months and the implications of any changes. On the 16th of February, SDLP and Sinn Féin members proposed and seconded proposals that would see providers funding top sliced for the coming year, and we opposed this. Advice Northwest would have lost almost 25,000. RCD potentially around 11k, and Dove House would gain over 35. That would bring RCD down to 2014-15 levels. Dove Houses would be at its highest ever, and Advice Northwest would just to 2017-18 levels, when other caseloads were a lot smaller. Information given to members shows that under the current formula, Advice Northwest doing 3 to 5% more work than 2017 would see their funding drop. That would affect the jobs of those who have given their all over the last year alongside our medical heroes. More recently, members of the advice panel met on the 29th of March. The three providers came and provided information to us. The three providers were asked by me if they were under the impression or had information that would prove that council informed them not to worry about recording numbers during the pandemic. All three independently confirmed that was the case, though I'm now told staff at council dispute this. Briefings revealed that some providers would not record the same case types as others, as under the commissioning agreement for all providers, only significant advice should be recorded. It's obvious from the testimonies we received openly that this is being interpreted differently, meaning providers in good faith were carrying out advice work but not recording it as significant advice, therefore affecting their funding in the long term. Now I come, Chair, to the issue I want to raise, now that I've given the background. This council signed off on funding from DFC for the Financial Inclusion Programme and the Access to Food Programme, and we allocated that funding through our local growth partnerships. In my DEA's case, this was managed by GSAP. We know from council reports that by the second week of January this year, 334 families were assisted through food vouchers, fuel support, or white goods being purchased to the value of almost £37,000 in my DEA in one programme. Each of these programmes has an advice component. Indeed, on the forms used by the scheme administrator, it specifically refers to asking clients if they needed advice, should, for example, their finances need reviewed. It would be fair then to say that many of the hundreds of individuals that came through these schemes, many would have needed, for example, a benefit check, perhaps even specialist advice or debt advice, and would have been referred to one of the three providers. It would also be fair to say, I believe, that those in Ballyarnett would have been referred to Cairnhall Resource Centre, which was actually open for appointments face-to-face over the period, unless they needed specialist debt advice, for example, where they would go to Advice Northwest. You can imagine my shock then when one of the advice providers told us at the advice panel that they referrals and engaged with their local growth partnership on programmes such as delivering food. And when I inquired with Cairnhull, their answer was entirely different. On the financial inclusion programme and all tranches of the Access to Food programme, which I remind members has an advice component, the locally situated advice provider in Ballyarnett received a total of 0 referrals. This is despite there being contact between the resource centre and the administrator 3 times around different programmes, ensuring that referrals could be made. So, Chair, we have an advice provider telling the panel on the record they were getting referrals from their local growth partnership and even helping with delivery of the programme on the ground, which is to be applauded. And yet, my DEA advice provider received 0 referrals through any of the programmes. I don't believe for a second that people of my DEA didn't need some form of advice provision through this difficult year. Where did the referrals go? Let me be blunt, Chair. There has been for some months an open secret in my DEA that another organisation wanted to provide council-funded advice provision. Naturally, at present, this isn't possible as we have no more funding to give and our providers operate to a high standard. It's not for me to make accusations or name names at this committee. That would be for the audit team. But call me a conspiracy theorist, it's not out of the realms of possibility that any new provider of advice in my DEA would have to see Cairnhall Resource Centre off first, and to do so would have to reduce its workload and therefore funding until it became unable to support itself. So what happened to these referrals? Did they go to other providers? And why? I'll be seeking an independent audit of provision at the next meeting of the advice panel, but it is essential that I, this council, and those we serve are assured that public money we approve is being used in the best possible way to support our communities. And so I ask, how did the providers come under the understanding the council told them, rightly or wrongly, that recording cases would be less of a priority during the pandemic? And why were referrals not received by Cairnhall Resource Centre from the Ballyarnett Local Growth Partnership for DFC projects in relation to advice when it's obvious that others in other areas such as Triax did? Thank you, Chair.
Thank you, Councillor Doyle. Councillor Duffy, you wish to speak on the matter? Go ahead, please.
Yes, thank you, Chair, and I appreciate you allowing me, and I'm not on the committee. I'm not going to comment on the advice panel stuff because I'm not on the advice panel, so not over all the issues. But I will comment on the spurious allegation there that is being made by Councillor Doyle. Councillor Doyle should familiarise himself with the Ballyarnagh DEA. The Ballyarnagh DEA may have Cairnhill Resource Centre situated within it. It also has outreach advice services from Advice Northwest. And I would ask Councillor Doyle, was he aware of that? Because that has been going on now for quite a number of years. In fact, it was myself that organised for Advice Northwest to be situated within the Chantal Community Centre a number of years back. So I don't know what point he is trying to make, but in terms of advice services through the Ballyarnagh area, we don't just have Cairnhill Resource Centre.
Thank you for that, Councillor Duffy. Anybody else wish to come in? Martin, if you'd like to come in. Sorry, Councillor Riley.
Yeah, thank you, Philip. I suppose a point in relation to what Councillor Doyle has said in relation to the advice services panel. Like Councillor Duffy, I'm not a member of that panel either, but I have been aware of the issues going through the Health and Communities Committee, of which met recently, and at the advice services panel meetings, the SDLP, contrary to what Councillor Doyle is trying to insinuate here, challenged proposed cuts, and no formal recommendation has been put to Health and Communities. So to try and present it as something that has happened, I think is incorrect, Chair. So I understand, as you said at the start of the Chair's business, that you're not taking proposals, and Councillor Doyle hasn't made a proposal. He's just asked questions. I think that if you look through the minutes of Health and Communities, and indeed at full council when this has been raised, there's clear outlining of our party's position in relation to this issue. Thank you, Chair.
Thank you for that, Councillor Riley. Okay, any other speakers?
Chair, can I just come back if you don't mind?
Yes, I'll give you a minute. Yeah.
Certainly. In answer to the both speakers, Martin, the proposal was made at the advice panel and has been minuted, was proposed and seconded, and then was put back because others, including myself, opposed it. And in relation to my DEA colleague, yes, I'm perfectly aware that that's the case. And it, the question stands: if there are more than one advice provider in the DEA which serve all of the people of the city, which we know there is, why were no cases put before one of them? None at all. Whereas we know in other DEAs, the system has worked differently, and advice providers on the ground have been given hundreds of referrals. That's the reason why I raise it. And I respect, Chair, what you're saying about a motion. I was going to put a motion forward, but I respect what you've said. I've spoken to Denise and her team about this already. I am asking for an investigation to be carried out because it's very clear the public money has an application here, and I'll leave that to your good self to determine how we can do that. Thank you.
Thank you, Councillor Doyle. Councillor, as I said at the start, before I allowed you to speak, I would suggest you bring this to full council and perhaps maybe ask them for a paper to be submitted to Health and Communities Committee. So I take it that that is the matter now closed off at the minute, and we'll move on to matters arising from the meeting held with the AAR on the 15th of February. Have any matters arising? No matters arising. We'll move on to item number 7, which is the internal audit reports, and I believe James is going to take us through that.
Sorry, Chair. Sorry to be just in terms of accuracy for the minutes previously. I'd looked through. It could just be a mishap, but we had discussed the last time. I think it was around the corporate risk register, and I had asked for it to be considered that mental health be put on that. I think someone was either going to come back at that point, but I haven't heard anything. And just double checking because it's not minuted there. Thank you, Chair.
Thank you for that, Councillor Doyle. The actual risk review process is going to be spoken to later on item number 13, and maybe we'll ask Anne-Marie to talk about, bring that up. Thank you. If we can move on to number 7, please, the internal audit reports, James.
Thank you, Chair. The purpose of this report is to update members on the internal audit work carried out within Derry City and Strabane District Council in the period April to June 2021. As per the Council's internal audit plan, the following audit work has been finalised recently: the audit of the North West Regional Development Group. On the basis of the audit work carried out, the controls in place over the North West Regional Development Group provide satisfactory assurance that the system objectives will be achieved. The internal audit is satisfied that the internal systems and controls were adequate over the areas of expenditure, income and budgetary control. The internal audit also found a high level of compliance with the conditions of the Executive Office Letter of Offer and that appropriate governance arrangements were in place. The audit did identify a small number of issues and 7 recommendations were made as a result of this audit. The table of recommendations, the management responses and implementation dates can be found in page 21 of the report, which is attached to Appendix A. Also, the other internal audit work there is noted, detailed at item 3.3. There's no budget implications arising as a result of this business, and the recommendation is to seek members' comments on the internal audit reports. Thank you.
Have we any comments from the floor? Okay, right. Can we move on to item number 8, which is internal audit strategy, and James is going to take us through that as well. Go ahead, James.
Thank you, Chair. If it's okay with you, we'll take items 8 and 9 together, the strategy and plan.
Yep, no problem at all. Yep, certainly, James.
The public sector internal audit standards requires internal audit sections to have an internal audit strategy and plan for the year ahead approved by the organisation's audit committee. The internal audit strategy and plan details a work plan for the internal audit section for 2021-2022. The internal audit strategy and plan presented for members' approval is based on a number of factors, including the results of the audit needs assessment for the organisation, consultation with senior management and the available resources. The key challenge of the internal audit section over the coming years is to continue to provide an appropriate level of assurance, taking into consideration the impact of the COVID-19 pandemic upon council operations and upon the internal audit section. This includes the limitations on internal audit's normal working practices as a result of the pandemic. As a result, the internal audit plan for 21-22 still has a significant element of work as a result of the pandemic contained within it. The key elements of the plan include internal audit work as a result of the pandemic, completion of audits from 2021 and plan and where fieldwork can still be completed, follow-up audit work and planned audit work in other areas. As you know, members, the internal audit section is a small section in council, and we think that this strategy plan provides assurance work and coverage across the organisation in a wide variety of areas based on the resources available. There are no financial implications arising from the report, and it is recommended that members approve the draft internal audit plan for 21-22. Thank you.
Have we any questions? Okay, can we move on now to item 11, which is the Northern Ireland Audit Office audit. The Derry City and Strabane District Council annual audit.
Excuse me, Chair. Sorry, Chair.
Yeah.
Excuse me, Chair. Sorry, we need a proposal from seconder, please.
Oh, sorry. Can someone propose?
No propose. Councillor Maguire.
Propose.
Second.
Thank you. Thank you, Darren. Thank you. Okay. Move on to item number 10. Derry City Strabane District Council annual audit letter. Denise, are you taking us through that? Hello?
It's John Kelby here. I'm not sure if Denise can hear us, but we're joined by Colette Keane, who I think is going to speak to the report. Is that right, Colette?
Yes, I'm happy to take the reports, the next 2 reports, Chair, if you're content with that.
Yeah, 10, 11 together. Yes, Colette, please do.
Apologies, Chair, I couldn't get my mute button off, so apologies for that. Thanks.
Thank you. So the first document is the annual audit letter, and the annual audit letter marks the completion of the audit, in this case for the year ended 31st of March 2020. This document summarises results of the audit and is a standard format for all councils. Once agreed, this will be placed on the council's website. Members will recall I presented a summary of the audit in the report to those charged with governance at the last meeting. Chair, I didn't intend to through the document. It's a fairly standard document. As I said, it is in standard format for all councils. We do obviously tailor it to for any circumstances arising during the audit. But as members know, the audit was unqualified, although we did include emphasis of matter paragraph around the airport, and that is explained within the document. I'm happy to take any questions on the document. Thank you, Chair.
Okay, any questions from the floor? Okay, are you going to take number 11 as well, Colette? Yeah.
I am, thank you, Chair. So just moving on swiftly then to number 11, which is the audit strategy. So we've just finished off 1 year and we're back starting again on the next audit. So this document sets out the audit approach to the audit of the 2021 financial statements for the council. And this, again, it's a standard document. I will highlight any issues within it. So just to say, I would point out on page 2 of the document that the performance improvement, we normally would include the audit approach for performance improvement within this document. But unfortunately, the decision as to what that will look like for 2021 has not yet been agreed yet by the department. So you'll see there on page 2, we just give a bit of update on that. We're still waiting for some change in legislation to go through and to see what that's going to look like. And we'll work obviously with council and with the department in the future when that is clear. And then just at the bottom of page 2, you'll see there what the actions are for this committee are. So they have to consider whether our assessment of the risks, the material misstatement to the financial statement is complete, whether management has plans to address those risks, whether our proposed audit response addresses those risks, and whether they have any knowledge of any actual suspected or alleged fraud affecting the council or instances of non-compliance with laws and regulations that could be expected to have a fundamental effect on the operation of the council, and to communicate those to us. On page 3 of the document, you'll see where we've calculated the materiality for this audit. And there's 2 sets of materiality because, as members will know, council prepares group accounts which include the airport. So there's one for council and then there's one slightly higher for the group. And but this is a quantitative amount, and as members will know from previous years, we'll always be keen to highlight the materiality. It can be a much lower amount depending on the circumstances of particular items of expenditure, and some of those are highlighted at the bottom of page 3. The next page then we just to highlight certain things that we want to give assurance around. First of all, we are independent of council, and therefore that's a very important element of our audit. Also how we manage personal data, how we work with James and his team in internal audit, and then any specialist skills we rely upon, in this case, NILGOS auditor, the NILGOS pension scheme actuary, which we receive information from, and also land and property services. And then if I could bring members across to probably the most important part of the report, which is on page 6. And this is where we highlight any significant audit risks that we have identified at this stage. So first of all, there are 2 significant risks we're required to consider under our auditing standards, and these are highlighted at the outset. The first of these is the presumed risk of fraud and revenue recognition. And we don't believe there is a risk of fraud and revenue recognition which is material for these financial statements. The second is the significant risk in respect of presumed significant risk of material misstatement due to fraud through management override of controls. And this is common for all audits, and we have designed a suite of tests to counteract that and to look for any risks around that. I suppose most importantly is the significant risk at the bottom of page 6 of this document. And we have decided to include once again a significant risk around the City of Derry Airport going concern. We do appreciate that council have been able to have projected that it has sufficient funds to ensure the financial viability of the airport until at least February 2023, and potentially beyond that. But you'll see at the bottom of page 6, we've identified some concerns that we would have around the whole issue of travel and travel restrictions that are currently in place and how those will play out in the future. So we've decided to continue to treat this as a significant risk and to focus on it as part of our audit. On page 7 of the document, you'll see we've also identified 2 risk factors. The first of these is financial resilience, and I note that on the corporate risk register, you could continue to be concerned about the financial resilience of council, and that is where that is coming from as well. And then, of course, 2021 was a year where there was extensive COVID-19 expenditure going through council, so not surprisingly, we also have focused on that as part of our audit. The timetable for our audit is on page 8, and you note, members, that we tend to try and get back onto our normal schedule of completing the audit by the end of September. As you know, we had an extension last year to the end of December, but we're hoping with council support that we do get back onto our normal schedule. And then just to say, in terms of the audit team, I'm pleased to say that on page 10 that we've been able to keep the audit team fairly consistent from previous years as well. Chair, I'm happy to take any questions on this.
All right, okay. Thank you for that, Colette. Any questions on the briefing we've just had there? It was been through. Can I just ask Denise there to mark down Gary Donnelly in attendance, please? He's just joined the meeting and a problem there with his IT.
Yes, no problem.
And we've all been there, haven't we? Right, okay, now I'm going to move on to the Health and Safety and Wellbeing Committee update, please. And I believe Una's going to take us through that.
Thank you, Chair. The purpose of this report is to provide an update to members on the recent Health, Safety and Wellbeing Committee meeting, which took place on the 15th of March 2021. The main committee summary report presented and discussed at that Corporate Health and Safety Wellbeing Committee is attached in Appendix F. The covalent reports for the 2021 reporting period was discussed and progress reported from each directorate. Additional to the covalent reports available at the time of the meeting, the 2021 reporting period has now completed and final reports can be found in the attachments G to J. The COVID crisis formed a significant proportion of the discussion during the Health, Safety and Wellbeing Committee. Compliance training, internal audit programme, and other items listed in section 3.8 of this report was discussed in detail with the senior team at that time. Members are asked to note the contents of this report and continue to endorse the health and safety management systems and processes which are in place within this organisation. I'm happy to take any questions that members may have. Thank you.
Any questions? Okay, can I have a proposer, please?
Chair.
Sorry, Patricia, go ahead.
Sorry,
Patricia,
Chair.
go ahead.
Is this all the reports you're taking? All the committee reports? I want to talk about something in Appendix L.
Okay.
Is it just one by one you're taking in it, or is it?
No, it's them all in their entirety.
Right, it's Appendix L, and it's the audit action status as of the 11th of 3rd. There is due dates, but then the implementation date and the signed off, but there's nothing. There's only it's saying no to everything. So I was just wondering why is that? I mean, there's some implement due date the 29th of 1st, 21. There's a number going right up to March. There's ones later in the year, but there's no information as the have they been actioned?
Okay, so that is the internal audit report that's run within council. So that was at a point in time going on to that meeting. I'm happy to take that report, filter through it and send the updates directly to yourself if that would be helpful, so I can give you the most up-to-date information.
That would be grand, so it could let us see if the recommendations are done or whatever. Thank you.
Yeah, no problem.
And could that be brought to the next AAR meeting, please?
Yes, no problem, yeah.
So we all said, thank you, thank you. Any other questions? Right, now, I omitted to ask for proposal and second to the previous one. I have Councillor Riley and Alderman Guy who are proposing, if we could make note of it, please, number 10 and 11, both proposed and seconded. Thank you. Can I have a proposal and seconder for HNS and Wellbeing Committee update, please? And a seconder.
Seconded. Darren.
Can I propose her?
Happy to propose it, Chair. Councillor Riley.
Thank you. Okay, can we now move on to item 13, which is the risk review process and update on council service risk register, and Anne Marie's going to take us through that. Can't hear you, Anne Marie. Can't hear you.
Change the other computer there, I would say, because it happened
I
last.
think so.
Anne Marie's just using computer here.
Okay, right.
Sorry about that. Seems to be a problem.
No worry, Anne Marie.
The purpose of this report is to provide an update on service risk register reviews completed during the period from October 2020 to March 2021. So you'll see from the report that there have been quite a few areas reviewed during the period. There have been 15 risk register reviews completed. As you know, the risk registers are in a format with which you're all familiar, and they're subject to regular review. All the service areas that have been looked at have taken into account any potential risks associated with the current pandemic, and the risk registers have been revised to detail any controls and actions that are in place. So for your information, there's a number of complete risk registers attached, and they are streetscape, grounds maintenance and cemeteries management, human resources and Piece 4. So on review of those registers, you'll see that they detail all the risks and the controls that are in place. Moving on then, Appendix P details all the current, high and critical scoring risks that are included on the service registers throughout the organisation. And the report also includes the detailed controls that are in place to mitigate those risks. So there's a summary there included of all the high scoring risks on the registers across the organisation. But I'll not go into all the detail of that unless there's any questions on it. So the risk registers provide the assurance that there are appropriate controls in place for any identified potential risks. As mentioned earlier, during the risk register reviews, consideration has been given to service risks associated with the COVID-19 pandemic. So for this quarter, there's an additional report attached as Appendix Q, and that details risks identified to date associated with the crisis and the current controls that are in place to mitigate. So the service risk register report is presented for your review and comment. So I'm happy to take any questions.
Councillor Doyle, you had a question earlier for the about the corporate risk register. Would you like to bring that, please?
Thanks, Chair. Yeah, and I appreciate the reports. Thank you. I think mine was about the overall corporate risks, but I think we had mentioned at the last meeting that one of the overall corporate risks would be mental health. I'm just wondering, I know we're not going through the corporate risk register today. This is for the section by section. Any idea where we are with that one? Thanks.
Okay, so the mental health of our citizens, although it's not a direct responsibility of council, mental health would be considered right across the organisation and the various service risks where, you have health and communities, leisure, our strategic growth plan. You know, the mental health is incorporated into those risks, councillor. Although we didn't have a separate risk on mental health on the corporate risk register, as it's not a direct responsibility of council, although the corporate risk register will detail that we're working with all the statutory agencies as regards any sort of responsibilities that council has in that respect.
Does that answer your question, Councillor Doyle?
Yes, thank you, Chair.
Okay, thanks very much for that, Murray. Can we have a proposer, please?
Proposed.
Proposed, Chair.
Thank you, Patricia.
I'll second that.
Seconder,
Chair.
thank you, Darren. Okay. Next on the agenda, we have the confidential for decision. Can we move into confidential, please?